Welcome to this series of videos on communicating with chronic pain patients. This is Module 8, Difficult Conversations with Frustrated Patients. Have you ever walked into an appointment and immediately realized, this is going to be a difficult conversation? Maybe the patient says, I've seen 6 different providers and nobody has helped me. Or, physical therapy didn't work last time. Why would this be any different? Or maybe, I'm tired of people telling me there's nothing wrong with me. I'm in pain every single day. What's your immediate reaction? It's easy to become defensive. We want to explain. We want to correct. We want the patient to understand that we're different from the other providers they've seen. But here's something important to remember. The frustration may be directed at you, but it may not be about you. Patients with chronic pain don't walk into our offices as blank slates. They bring every previous healthcare interaction with them, and some of those interactions may not have gone well. A 2025 study surveyed 165 clinicians who specialize in pain and asked about the unhelpful messages their patients had previously received from healthcare professionals. 5 themes emerged. Patients had been given messages suggesting, it's all in your head. Your body is fragile. We just need to find the one thing that's causing this. Or perhaps most damaging, there's really nothing else we can do. The researchers concluded that these messages can invalidate pain, discourage movement, create diagnostic uncertainty, and communicate hopelessness. So when a patient comes into your office skeptical or frustrated, consider the possibility that you're not starting at 0. You may be starting at -10. Before you can build trust, you may first have to overcome years of mistrust. Imagine a patient says, nobody takes my pain seriously. A natural response might be, that's not true, I'm taking you seriously. But notice what just happened. The patient made a statement, and we immediately argued with it. Now imagine responding, it sounds like you've had experiences where you didn't feel believed. Very different. You haven't agreed that every healthcare provider treated them poorly. You're acknowledging their experience. Remember our earlier principle, validation is an agreement, and validation is particularly important when emotions are high. If a patient raises the emotional temperature of the conversation, our job isn't to raise ours to match it. Our job is often to lower the temperature. One useful technique is simply acknowledging what you're seeing. You might say, I can see how frustrated you are. Or, it sounds like you're exhausted from going through this over and over again. Or, it seems like you've lost some confidence that anyone is actually going to be able to help. Then stop. Give the patient an opportunity to respond. You don't need to immediately fix the emotion. Sometimes naming it is enough to communicate, I see you. Here's another scenario. A patient says, physical therapy is useless. I've already done it 3 times. If you're a physical therapist, you may feel a little defensive. You might want to say, well, you haven't done physical therapy with me, but instead try curiosity. You've already gone through therapy 3 times and you're still dealing with this. What was your experience with those treatments? Now you're learning. Maybe the previous treatment was completely passive. Maybe exercise caused a flare-up and nobody explained what was happening. Maybe the patient was given a home exercise program that took 45 minutes twice a day. Maybe the patient felt dismissed. Or maybe physical therapy genuinely wasn't helpful. We don't know until we ask. Curiosity prevents us from defending ourselves against an information we haven't even understood yet. This may be one of the most important principles in a difficult conversation. Don't try to win. Suppose a patient says, my MRI proves that my back is completely damaged. You respond, actually, research shows that lots of people have those findings without pain. The patient says, but my surgeon told me my discs are severely degenerated. You respond, yes, but degeneration is common as we age. The patient says, you don't understand. I know something is seriously wrong. What are we doing? We're having a debate. And even if you win the scientific argument, you may lose the patient. Instead, try. It sounds like what you were told about your MRI really changed the way you think about your back. Then ask, what did they tell you those findings meant? Now you're not debating, you're exploring. And once you understand the patient's interpretation, you can ask permission to offer another perspective. Would it be okay if I shared a slightly different way of thinking about those findings? That's a conversation. Sometimes what a patient says isn't actually what they're worried about. A patient might say, I need another MRI, but underneath that request may be, I'm afraid something serious has been missed, or I need someone to fix this. May actually mean, I'm scared this is never going to get better. So instead of immediately responding to the request, explore what's underneath it. Try, tell me what you're hoping another MRI would help us understand. Or, what's your biggest concern about what's happening right now? That question can completely change the conversation because now you're addressing the fear rather than simply debating the request. A large evidence review examining communication between healthcare professionals and people with chronic pain found several consistent themes. Patients valued being believed, being listened to, empathy, open and non-judgmental communication, and a supportive collaborative relationship with their healthcare provider. Research on pain invalidation tells us what can happen when those elements are missing. A thematic analysis examined 431 published articles containing narratives from more than 7,700 people experiencing pain. Common themes included not being believed, lack of compassion, lack of understanding, stigma, and eventually even critical self-judgment. So the frustrated patient sitting in front of you may have a history we know nothing about. And sometimes our first job isn't changing their behavior. It's demonstrating that this interaction can be different. Of course, patient-centered communication doesn't mean agreeing with every request. There will be times when you need to say no. There will be treatments you don't recommend. There may be tests you don't believe are indicated. There may be beliefs you need to challenge. The goal isn't to avoid disagreement. It's to disagree without becoming adversarial. Try this sequence. Validate, explore, explain. Partner. First, validate. I understand why you'd want another MRI. You're still hurting and you want answers. Then explore, what are you most concerned we might be missing? Then explain, would it be okay if I explain why I don't think another MRI would change our treatment plan right now? And finally, partner, let's talk about what we can do next and make sure the plan addresses what's most important to you. Notice that you still said no, but you didn't dismiss the patient in the process. And finally, sometimes we get it wrong. Maybe you interrupt. Maybe something you say comes across as dismissive. Maybe the patient becomes defensive. Don't pretend it didn't happen. Repair it. You might say, I don't think what I just said came across the way I intended. Let me try that again. Or, I may have jumped too quickly into explaining instead of listening to what you were telling me. That's not weakness. That's communication. You don't have to be perfect to build trust, but you do need to recognize when trust has been damaged. When a chronic pain patient is frustrated, skeptical, or upset, resist the temptation to immediately correct them. Remember, there's probably a story behind the emotion. Don't match emotion with emotion. Name what you're hearing. Get curious instead of defensive. Look for the concern underneath the complaint, and don't try to win the argument. When disagreement is necessary, remember, validate, explore, explain, partner. Because the goal of a difficult conversation isn't to prove that we're right. The goal is to preserve enough trust that we can continue working together. Sometimes the patient who appears the most difficult isn't asking you to have all the answers. They may simply be asking, are you going to listen to me, or is this going to be just like every other healthcare experience I've had? How we answer that question may determine everything that comes next.